thank you all for coming tonight. And March isn't just about March Madness, my Syracuse tie here, go Orange, but it's also Developmental Disabilities Awareness Month. So it's a great time to have this meeting. It's long overdue. I've been with the ARC 16 years now. I don't think we've ever had a community meeting like this, so hopefully it's the first of many. Cheryl Englert, board president, is joining me tonight. I'm Miskell, the executive director. Again, thanks for coming. Hopefully, by the end of the night, you'll realize that we are your family, your friends, your neighbors, your coworkers, and your classmates. We started off young, our Kids Start program. We move on to the college experience program, Lives, with Geneseo. Then we have retirement. So we have everything in between. So we're going to move forward. So about a year ago, the agency realized all the changes that were coming and realized we needed to do a better effort with outreach. So we went through a branding process. And some of you may have received a survey to fill out. And what that survey did was give us information to let us know how people felt about us, what they thought about the ARC, what we did well, what we could do better. And we hired a consultant from Causeway, which is the old ad council of Rochester. And we had a cross-section of staff from all the different programs, board members, community members. We sat down in a room for a whole day, and everyone was throwing out ideas of what we want, what is our brand, what do we want people to think about when they think about the ARC of Livingston-Wyoming, and how do we get there? And so ideas were flying all over the place, and the facilitator did a phenomenal job boiling all those ideas down and came up with this brand promise. So only the ARC of Livingston-Wyoming is here for you and our communities to provide comprehensive supports and services that offer the peace of mind, guidance, and expertise families seek to empower their loved ones with disabilities, to navigate the challenges and experience the joys at all stages of life. And that really sums it up. We are a birth to end-of-life agency, and this really has helped us with everything going forward, which I'll get into. If there's any doubt, we will refer back to our brand. So here's our agency structure, obviously a tree, and all the different programs we provide are the branches. The administration is the trunk. I was joking with Jeff Thomas, our PR director, that the trunk is a little too fat because our admin percent is only 7%. So we are a lean and mean organization. And the roots of the organization is our board of directors, and they reach out to all the communities. We have a nice cross-section of members from Livingston and Wyoming counties. Speaking of board of directors, how many are here? I know we have Sherry. I know we have Tim McCallum from our ARC Foundation. I know we have more coming tomorrow night. We have we have several snowbirds as well. Senior management. We have a great senior management team. Those that are here, please stand up and I'll give you a shout out. Come on up. We have Mike Fitch back there, and we have Lori Perino down here, and John Warner and Deb Tuckerman and Kelly Kennedy. I think Jim Mullins around here somewhere, and of course Jeff Thomas that I mentioned. So the amazing thing about our team is that I did a quick little math, and our senior management team has 152 years with the ARC of Livingston-Wyoming. So that's a lot of knowledge, a well-rounded team, so we really appreciate them. And there's a little caveat to Geneseo. We happen to have quite a contingency of which to live in Geneseo. So, but 10 of the 12 live in our two counties, which is great. But the real backbone of our agency is our direct support professionals and the DSP. So, and I apologize, there's a lot of acronyms tonight. I'll try to explain them, because I know that can be overwhelming. But there's a residential team right there. You'll see a photo later on of our hilltop team. But the DSPs are the backbone. The majority of our employees, they do most of the grunt work, and they have to deal with individuals on their best day and on their very worst day. And they do a wonderful job with it. I was fortunate to be notified a couple months ago. One of our individuals was on hospice care in our house. So we provide hospice in our homes. And the director gave me the heads up, and that Chris was failing, and so I was able to go over and visit with Chris for a few hours and watch our staff firsthand provide care to Chris. And it was unbelievable. They do such a phenomenal job. And it was wonderful to think that Chris knew he was in his own home, the people he knew, and was able to pass away that way. You can't put a dollar figure on that. It was incredible. So really, thanks to the DSPs. A little bit about our history, because this meeting tonight was to give you an update on the CCO structure, which we'll get to, but also a first-time meet and greet for me, for a lot of you. So I want to give you a little background for those who may not know. I see some older folks that have probably been around for a long time, and that Sherry knows. But our chapter started back in 1961, and the parents got together to form a preschool. The ARC in New York started in 1949, so we're a little bit behind the state ARC, but our chapter started in 61. People like Mary Derby, who probably many of you know, started that program. And then that's where it all began. You know, the parents got together, and they achieved that, and then it was like on to the next thing. What are our loved ones going to do when they age out of school? What program are they going to go to? Where are they going to live? How are they going to get there? And that's what we really have done. The chapter has really grown tremendously by adding programs and supporting more individuals. And we are one chapter of many. We're part of the ARC in New York. Every county has an ARC chapter. And we're also part of the National ARC. And we are a private 501c3, which you will know. And the National ARC is the largest not-for-profit in the country. ARC in New York is the largest in the state. And believe it or not, we're the largest not-for-profit in Livingston-Wyoming County. And many of you may not know that, but you should know that. You should be proud of that. You all know about Special Olympics, and they are much, much smaller than we are, but they have much better brand recognition. So we need to do a better job with our brand. And you can see that logo in the bottom left-hand corner, that ARC swoosh. And that's actually the National ARC logo that we adopted a couple of years ago. The ARC of New York adopted it just in October. So we're hoping more and more counties adopt that. I was talking to Michael, and he's going to ARC of Erie, I think, tomorrow. And they, up until a couple months ago, they were the heritage centers in Erie County. So it's great to see they're changing their brand. And it's very, very powerful because for recognition, for acknowledgement, to have a parent-driven organization, it's great to see. Now I'm going to pass the baton on to Sherry, and she's going to tell you a little story about her son, Matt.
Welcome, everyone. It's great tonight to see so many familiar faces that I've known through the years. My history with ARC started in the fall of 1979, when my son Matt, who was born in '76, needed a preschool program. Back in those days, there wasn't a lot floating around Livingston County. We were lucky to find an early intervention mobile bus that came down to our neighborhood because we live out between Wayland and Springwater. So he got early intervention services from that. Because I'm a special ed teacher by trade, although now I'm retired. So I knew enough to go look for services. And we ended up when he was 3, the family doctor said to me, when he was 10 months old, don't worry about it, he'll be fine. When he's 3, maybe you can look for a program. And I'm not going to sit around, stay out of the trouble, mom. So I went and found him the early intervention project, and we got him into services when he was 10 months old. So when he got to be 3, we enrolled him in the Kids Start, only then it was Children's Services Preschool. And from the first days I went there, we had funding problems. So as I told the Board of Supervisors last week when they came to visit the workshop, I was down in courthouse down at the end of the street petitioning for better funding for preschool. And heaven forbid, we're having to do the same thing today. So we got in preschool, and by the end of his first year in preschool, I was recruited to join the board in June of 1980, and I've been here ever since. I'm really proud of the service I've given to this organization, and I do it not only for my son Matt, but for all the other folks that come through our program. As a retired special ed teacher, I've seen a lot of folks come through my classroom and a lot of families that need help. And I think that's my mission, is to help all the families. because I couldn't do anything just for Matt. It wouldn't be fair. He went to BOCES program for all his school years, but we used the family support services that ARC provides, special sitters, so that I could come to ARC meetings and go to parent meetings and do other things. We used family reimbursement to pay for special things he needed in his life, like specialized horseback riding. So we used the services. He's had service coordinator, even though the service coordinator sometimes laugh at me and say I know more about their job than they do. But so they give me the newbies. They get, they chew on me and learn the ropes, and then go out and serve other folks. And I think that's a good part for me to play too. Matt now lives, and this will be 16 years in May, in a 4-bed IRA in Dansville with 3 housemates, very happy, has great staff. His site supervisor, I call his other mom. She and I are on the same wavelength, and a couple weeks ago he was home for a long weekend and was shoveling snow, strained his back, so we met at the ER on Monday morning, getting him some treatment. So, and the nurse goes, all right, who's mom? And Matt points to both of us and said, Mom and the other mom. But that's what we want for our folks that work in our houses. I want them to be the mom. I want them to help make those critical decisions and take care of him when I can't be there every minute. I mean, it was our plan from the time he was 3 and entered ARC services. I had his plan all planned out from then. Go to BOCES, go live in an ARC house, go to Hilltop. We tried Hilltop. It wasn't the best fit for him. Does anybody tell you? I'm not shy, I'll talk to anybody. So I enjoy doing this role, and I enjoy doing it. I'm now serving the state board of directors for ARC New York. I'm a regional vice president, so I take what's good for our area to the state meetings and tell them what's good for us upstate. I've gone to several meetings with the national convention for the ARC. We go to Washington in April again to meet with the national for disability policy, for government policy. And I think one of the main jobs I have as being a chief volunteer for this organization is to reach out to the community, to talk to parents, to advocate for parents, to advocate for all the people we serve that don't have parents in the area, to talk to our legislators, to go to Albany, to call them up when they're here, to invite them to the workshop to see what the good work we do. We can never blow our own horn too much. And I think that's my job, to keep talking about we do a good job. We employ great people. We provide great services. And not only for my son Matt, but for, I think, for everybody we serve. And I'm always there as an ear to anybody in the community that wants to come and talk to me. If you have a problem, if you have something great to say. I got an email today from a mom who was just glowing about the services her child is getting. It made me so pleased. That's the best medicine I could get. It's the best praise from another mom saying, you're great for my family. And that's what it's all about. We are family. The tree you saw up there, I've been talking about that tree forever. I've been talking about this park is like a tree. Our board of directors, our roots, they're in the community. They're in towns across the community. Some of us are parents. Some of the board is professional people that have come from state service and have wealth of knowledge. Some are just guys that work in the community. We have a self-advocate on the board. He came through our preschool program. He works at Kids Start in the kitchen. That's what it's all about. We take care of our own, and we want to take care of our own in Livingston-Wyoming counties. And because of that, my Matt has that great smile on his face. Because he's happy. And I'm happy, and my husband, and my son and daughter-in-law, and my 2 grandsons, because we know he's in a safe place with professional, caring people. And that's what life's all about. Thank you.
And Sherry's absolutely right. We're too well kept secret. We do a much better job of getting the word out there, which is why we're here. Speaking of touting our own horn, I didn't mention how large we are. Many may be wondering, we are roughly a $30 million entity now, believe it or not. We have 725 employees. We support 450 of which are full-time. We support over 1,100 people with IDD. Those are big numbers. People don't realize how big we are. And we just do it. And so now we really need to get the word out there of what we do and why we do it. So carrying on with that, changing times. That's why we're here. It's interesting, I went back and did some date checking, and you know, you saw the 1961 date, and then really in the 70s, things started picking up. And people remember Geraldo Rivera and the Willowbrook expose, right? That really drew a lot of attention to the horrible conditions people were living through. And that spurred change, and they started pushing community residences. New York opened up its first home in 1977 here in Geneseo on Center Street. And it's grown ever since. And ironically, OPWDD was created 40 years ago, 1978. It was carved out of Department of Health into its own department, had its own rate structure, had its own oversight. And what's happening now? OPWDD, Office of People with Developmental Disabilities, along with the other O agencies, Office of Mental Health, OASIS, Office of Alcohol Substance Abuse, are all being rolled back under the Department of Health. They're totally going full circle in the last 40 years, so it's a little bit scary. And why are they doing that? Why are they rolling everything back under the Department of Health? Because they're shifting. New York State is being pushed into managed care. And managed care is a healthcare model. We have a rehab model. We receive Medicaid dollars, along with the hospitals, along with the nursing homes. So we are that square peg they're shoving in that round hole. And that's why they're doing it. And part of that is they're rolling out first the care coordination organizations, CCOs. That's the first step to managed care. And that's what we're here to talk about tonight as well. And that takes effect July 1. It's happening. Even though we were just approved 2 weeks ago to be a CCO in New York State, they are rolling it out July 1. So there's a lot to do between now and then. All our MSCs, Medicaid Service Coordinators, will become care managers for the new CCO in our area called PCS, Person-Centered Services. So here we are. These are slides that were given to me, joint agency from PCS. And so our service coordinators who currently have a caseload of over 600 individuals will be part of PCS, as I mentioned, July 1. PCS was approved, as I mentioned a couple of weeks ago, along with 5 other CCOs in New York State. So we got a total of 6 that were approved. And as I mentioned, a prelude to managed care, which is all about the health home. And what is a health home? Well, the name's a misnomer, right? It's not a real home. I don't know why they picked such a confusing way to describe it, but it's a bundle of services, different providers, communicating and trying to provide the best quality of care to one individual. So what's happening is our MSCs are going to be taking on more responsibilities as care coordinators. They're going to be taking on pieces of health care and behavioral care. So it's kind of all rolled up. And the ISP, Individual Service Plan, is going to be renamed to incorporate those changes into the life plan. And again, fortunately, that plan is going to be rolled out gradually, thank goodness. They originally wanted it July 1 for everybody, which was an impossibility. But it's going to be based on the annual review. So our service coordination team will be care coordinators. We'll really be doing almost the same job they're doing today, July 1. And as those people, the life plan is enacted, things will start changing. But they're going to have the same caseload, same location, so the idea is to have a smooth transition into CCOs. But why is all this happening? And I have to be frank, it's the almighty dollar. New York State got its hand caught in the proverbial cookie jar with Medicaid. And they were overbilling Medicaid, they got caught, they had to pay back millions of dollars to CMS, Center for Medicaid and Medicare Services. And as a result of that, they also made New York State become more accountable, which is a good thing, to be more accountable for taxpayer dollars. And so a result of that was pushing New York into managed care. And so those are that's a cruel reality. And it's happening, we have no control over it. And the July 1 deadline is that deadline because of funding, again, getting back to the money. Medicaid agreed to pay New York State 90 cents on the dollar for this transition period, starting July 1. So the date wasn't going to move, so we had to move to the date. So that's all happening. But there, on the flip side, with every change, there's an opportunity to do do things better. We talked about being person-centered. We're trying to be more person-centered. And this helps us do that. It's improving, hopefully it'll improve the health of our individuals and the whole life experience. And again, it's by incorporating all those different aspects of the life plan. And again, the idea is to lower costs, right? They're trying to prevent people from going to the emergency room if they don't have to. They're trying to prevent people from going into the hospital for admission or readmission or into nursing homes if they can prevent it. So they are trying to save money on that aspect. But again, the outcome is to be more person-centered and have a better quality of life. So I mentioned that they were just approved a couple weeks ago. And here are the organizations involved. There are 35 organizations, and they're all in Western New York, in the Finger Lakes. They're all current care providers, and they're all going to be making up the new care coordination organization. One of the things New York State did do for the providers, to appease the providers, was that the providers are making up the CCO. It's an arm's length after arm's length after arm's length corporation, but it's being made up of the providers. And so you see the 35 that are up there, some may look familiar. We're hoping to see more ARC logos in the future. 14 of these organizations are ARC chapters. When it is in full operation, they expect to support 18,500 individuals with care management. That's a pretty big number, and have 700 employees. July 1, 700 employees. So think about being approved 2 weeks ago. In July 1, you need to have 700 employees up and running with IT systems, with an HR department, with an accounting department, with a quality assurance department. It's a massive undertaking. Again, hopefully like us, the other organizations are trying to create a smooth as transition as possible. Our whole team, pretty much our whole team, is moving to the CCO. They were all given offers on Friday, as a matter of fact. I think people are pretty happy with their packages. And they're all doing it because they like it. They like what they do now, and they're all going to give it a shot in the future, see if they like it. I think they will. So it's good news for our employees, it's good news for our families, it's good news for our individuals for that smooth transition. So this is what was boiled down for their mission by the 35 agencies. Their mission: connect people to the care, support, and opportunities of maximizing their quality of life. Their quality of life. And then the vision: a community where all people lead fulfilling lives. So this is really, again, person-centered approach, and that is the goal. And I mentioned where we are. You can see the green area is all of Western New York. Finger Lakes, and we are dead smack in the middle here in Livingston County. So that helps us a lot. We're going to have a lot more regional meetings at our agency than traveling, which will be nice. The services they provide, again, is the MSC services they're currently doing and incorporating that behavioral and health component to complete that life plan. And it's important, the communication is really important. They're pushing more toward quality. I think I mentioned we are CQL accredited, Council on Quality Leadership. We were accredited for being person-centered and based on POMS, another acronym for Personal Outcome Measures. And it incorporates a lot of different things. It's interviewing people and really finding out what they want to do, how do they want to live their life. And that's part of this process. And to be able to support that is huge. I'm hoping all the other agencies become CQL accredited because I know they're going to continue to push the POMS. And the difference between an MSc and a care coordinator can be explained by the simple concept of a little bit more for those who need it and select it. I like that line. But getting back to the IT, going toward that medical model, we need IT systems that communicate. A lot more data-driven, and we have a software package we bought a couple of years ago called Miskell, and it has electronic health records and can communicate with other softwares. Fortunately, the PCS is going to be adopting Miskell, another, which is huge for our staff. So through the transition, they're not going to have to learn a new software system like a lot of the other agencies are going to have to. I mentioned the timeline, again, very, very aggressive. and we are doing what we can to cooperate and make that go as smoothly as possible. And again, I think our team is pretty intact and pretty happy, and I see a lot of them here tonight. Thanks for coming, and hopefully you see some familiar faces out there. And hopefully, when you signed in tonight, you gave us your email address. So we do want to keep communicating with people, and there's data coming out daily about this from Person-Centered Services and also EWDD. And there's some data that's in your folder with different dates coming up. But if you want to get in touch with PCS directly, this is in your folder, so don't worry about writing it down. And we have Michael here tonight to answer any questions afterward. Give a big wave, there he is, front and center. And so we'll be getting that data out to you. There's these public forums I mentioned. I recommend that you go to at least one of them. It's the same presentation, so try to get to one. And they're fairly convenient, one being in Rochester, one being in Batavia, so please take advantage of that. So shifting back to the ARC. The variety of services we do. We took that branding exercise and we saw the changes that are happening, and we realized we need to try to adapt programming as well. So we entered into a strategic planning process. Mike Fitch and Jeff Thomas helped facilitate that. And we came up with 3 strategic priorities: programs and services, which is the bulk of our agency, the workforce, which is obviously enormous, that I mentioned, and financial sustainability. We'll start off with our youngins at Kid Start. This is a picture of the Lehman Center, which is over at Hampton's Corners. If you haven't been there, I would suggest you try to check it out. We built it in 2010-11. It was a logistical feat that I'm proud to brag about. After years and years of searching for a new location, because we were being evicted from the Holcomb School at SUNY Geneseo for their new sports stadium, we found this location, and we ended up buying the land in April of 2010. We broke ground in June of 2010, and we moved in January of 11 without missing one day of school. It was very impressive. We went from about 45,000 square feet, 2 locations, down to 33,000 in this beautiful building that's designed for our programs. And another thing you may not know is something as a Kid Start. Some of you may not know that Kid Start is, yes, Kid Start from New York. It used to be called Children's Services, and now it's Kid Start. But, something we can improve upon, getting that word out there. So Kid Start, currently, we went from the 12 children back in 1961 to about 350 children now. Huge increase. We have an evaluation center, we have early intervention, we have preschool, we have daycare, we have Head Start, and we have related services. Huge program, 2 locations, one at the Lehman Center, which is the biggest location, and another satellite down at the Dansville Middle School. So we have 19 classrooms overall, and we support a heck of a lot of kids. And it's really a unique program in that it's integrated. So we get surveyed all the time from different organizations, and for preschool, they're all fascinated by how our preschool program works. Because the preschool kids have integrated classrooms that are with daycare and with Head Start, and it works out really, really well. So when our preschool kids go off to school, K through 12, they end up aging out, and then you'll get that question, what do they want to do after they age out of school? So one choice is work, and we're going to go through the Hilltop programs, and Hilltop is also part of the ARC, right? It's one of those names that we have to get associated better. The Hilltop is the ARC. And the goal of the day programs is really to create opportunities for every interest and ability. Some folks want to work, some folks don't want to work. So how do we create those opportunities for everybody? And here's a nice photo of the Hilltop crew at one of their summer picnics. But their goals for strategic planning were becoming more of a social enterprise, continue to aggressively grow business, to continue to provide employment to people with disabilities in integrated settings, and to individualize our services to meet people's needs. So there we go. The person is the heart of all services, person-centered approach. So we move on from that to what is our most community-oriented program, Hilltop Community Services. And a lot of acronyms up here. I'll try to go through it quickly. We have supported living, community hub, and day hub without walls, to hourly respite, recreation in home. We have family support services, which include family reimbursement, special sitting crisis, and take-in outreach. We also have guardianship, and we also have family education training, or FED. And some of you may know Jean Angelilli. She's very engaged with that and out in the community. So that's the community side. On our center-based side, we have the Hilltop Vocational Services. And you can see there's different options here for different abilities at work. We have center-based programs for assembly. We have work enclaves out in the community. We have individuals alone out in the community who may only need to be seen once a month for some support and follow-up. But we try to cover the whole gamut. Here are the businesses of Hilltop. The center, of course, is our biggest, is the Hilltop Assembly and Packaging. We have the Finders Keepers Thrift Store, which is over in Mount Morris. We have the Hilltop Vending, which is around the county. And there's a nice collaboration with Whiteman's. They gave us some grant money to buy some vending machines, so that worked out very well. We have the Hilltop Print Shop, which prints business cards, which I have, all the way up to banners. So if you need anything printed, you need invitations, you need anything for work, please give the Print Shop a shout. We have the Hilltop Bottle and Can Redemption Center, which is in Mount Morris behind our transportation building. We have the Hilltop Cleaning Services, which is janitorial enclaves. And then we have the lawn service. We have 3 different crews for that take care of our properties and some state-owned properties. That's the work opportunities. Then we have programs of people who don't necessarily want to work. Sherry mentioned Open Roads Day Hub for Matt, and that program is actually for our seniors, and it includes, there's some integration going on there with folks who have early Alzheimer's. So we have a nice collaboration with Office of the Aging and the Noyes Hospital for that. And then we have Uptown Day Hub, which is some different population, but it's really life skills and socialization. And then we have Bridges, Day Hub Without Walls, which is kind of the same program, but people who need more individualized support. And then we have Lives, which I mentioned earlier, our college experience program, which is funded by Community Pre-Book. And then some of our folks may move into our residential program. We currently have 14 homes, 90 beds, and 7 supportive apartments in 2 counties. We're in the process of opening up another home to take some people off the wait list who are currently living with aging caregivers. So it'll be our first home in over 9 years. So we're taking advantage of a little crack in the system to fund the backlog of demand for housing. So you may live near our homes or participate in one of the homes, but they do a great job. I mentioned the DSP experience. And then under Deb talking about our Director of Clinical Services, is our clinical service program. And this is a pretty neat thing we've done and very unique to our agency. The CAST, Comfort and Support Team. And it really started with the Dragonfly Project. And the Dragonfly Project was created by a former employee, Kathy Schaefer, the nurse. She was wonderful, just had a heart of gold. She was a flower child, but she had a heart of gold. And Kathy started, and her goal was to record and document end-of-life decisions by individuals we support. And if you've ever seen some of the videotaped conversations, incredibly powerful. And she did a great job with that. As a matter of fact, one of our individuals passed away a few years ago, and the staff referred back to her interview in the CAST, the Dragonfly interview, and was able to meet all her end-of-life wishes. So something we all should probably do. No one likes talking about it, but it's a great program. And when we were accredited by CQL, we showed them some interviews from that Dragonfly project. And that pretty much sealed the deal that we were a person-centered agency, because you don't get any more person-centered than that. And the team was so impressed by the presentation that they asked our team to speak at their national conference, the CQL National Conference, which was out in Indianapolis. And they went out and did a great job. So we are hoping to, they're in the process of documenting more of that, turning it into a program, so they can share it with other agencies. But it all started here at the Arc of Livingston-Wyoming. Transportation, you may not know, but we have a gigantic transportation department. We have roughly 200 vehicles, about 70 buses. You may see the logos driving around the 2 counties, and probably up in Monroe County and all over the place. And we currently provide 345,000 trips a year, over 2.7 million miles. That's a lot of running around. With wheelchairs and everyone else, we have a nice collaboration with, again, Office of the Aging, with the county with dialysis. We transport folks back and forth to dialysis. And we're really growing this non-emergency Medicaid transportation service, which is kind of a taxi service for folks who receive Medicaid that need to get to appointments. And that helps provide needed discretionary revenue for our agency. So it's a great program. It's covering the cost of our internal transportation, which is great, and then some. So that's the program and services. We continue to want outreach. But now we're on to the workforce. And employee recruitment is huge. You know, at 4% unemployment, you know, it is a employee's market to shop. And so we're no different. Fortunately and unfortunately, with the increase in minimum wage, we are paying more, which is a good thing. But because we're not funded for it, we're experiencing some compression, which I'll get into later with the Be Fair to Care campaign, and Cheryl is proudly wearing a button for that. But we have great staff, we really do, and we're always looking. We do have some turnover, and we're looking for only the best people. So I'll ask you these questions. Do you have a desire to help others reach their maximum potential? Do you have good judgment in independent situations? Are you flexible and have problem solving to provide outstanding service? Well, if you are, then we would like to hear from you. So please apply or refer someone to us. We actually have a new recruiting specialist. Her name is Kelsey Holmes, and she's doing a bang-up job. So we are staying ahead of the turnover, but it's a challenging time for sure. The last area of the strategic plan is financial sustainability. Again, we're birthed into life care, and the transition for MSC is really difficult for us. Not only to lose great staff, but financially, it's really going to hurt. It's currently the only Medicaid program we are allowed to surplus in. So the surplus we've been getting from that program, we've been using to subsidize other Medicaid programs. So without leaving, it really is going to force us to reevaluate a lot of different things, tighten the belt even more. So other areas we're looking at is how do we get more profitability out of our hilltop businesses, that discretionary revenue, as I mentioned, and then identify new opportunities. And I'm all ears. Everyone here is ears. If you have any ideas, please pass them along. We will certainly listen. And that's where you do come in. You come in with advocacy. And looking back at the 40 years and the Mary Durbees of the world and the older parents that helped start the agency, they fought hard, and things really took off in the 70s, as I mentioned. They kept growing. They really boomed in the early 2000s with Medicaid, and the pendulum has now swung the other way. So people that fought for programs did that. They paved the way, and then we kind of got into a period, I'd like to say, complacency. Right? People didn't push as much to advocate. It was kind of programs were an expectation. Right? They deserved it. They were entitled to it. Well, that's not the harsh reality we're going to be facing. So I'm pleading with you here tonight, and hopefully hoping you can pass the word along that we need your support and advocacy. And a 40-year evolution of advocacy is turned, and we need to turn it back around again. So we need support from parents, from siblings, from people we support, from individuals out in the community. Everyone can help. Sign petitions, write letters, and more importantly, vote. Our legislators count votes. They pay attention to things in the paper, to articles. They really, really do. And they all want to be reelected. And we have to be the squeaky wheel. And we got to start squeaking hard now. And I also encourage you, we actually, Sherry mentioned Washington, D.C. And I want to mention the Be Fair again. The Be Fair Direct Care is an effort to put the funding in our rates. So it was pretty easy for the governor to pass these laws for mandatory minimum wage increases, which again, great. But in a 9-year period, minimum wage is going to go from $7.25 to $12.50. Currently, we're 3 years away from the $12.50. But it's had a huge impact, and it wasn't reflected in our rates. So the Be Fair Direct Care campaign is just put the money in the rates. We want to pay people, but you have to give it to us. So, and that's just for our DSPs. So all the other programs that don't have that OPWD funding aren't getting increases for minimum wage. So it's really putting the squeeze on our options. So again, support the Be Fair Direct Care. And then the self-advocacy, we have a group called ACT, Advocates Coming Together. Kelly Kennedy's involved with that. And we have a couple of representatives coming to DC with us next month. And their goal is to help educate our legislators, right? See it in person. And also to meet and work with other advocates from around the ARC world, this is the National Conference for the ARC, and to help create the platform for the National ARC. What are their goals going forward? So we definitely want to be a voice at that table. And then ARC membership. Our membership's $1. Everyone should be a member of the ARC. So and by doing that, you'll get a parchment newsletter every quarter, and you'll be up to date on what is happening with the ARCs. I think there's a little flyer in your handout today that shows all the ARC events coming up. But the membership is key. It helps us actually with the ARC of New York. We have a weighted vote chapter of the ARC of New York, and not all the ARC chapters have preschool or transportation. So to help us get those agendas higher on their priority list to advocate for, we have to have a higher weighted vote. So we really need that membership to keep growing. So as we wind down here, I want to leave you with our mission. We empower and support people of all ages with intellectual and developmental disabilities to be independent, productive, and dignified members of our community. And our vision is pretty simple: people with varied abilities living fulfilled lives in our community. So, questions? I hope there's a lot of questions. I know that there's handouts. I have Jen Warner from Service Coordination here to help, Sherry and Michael from PCS if I can't answer it. So let me switch microphones here. We have a pass the portable one on. We have Suzanne or Anna White here who has a mic, and she will ask anyone, or if you can scream in a loud voice like me, I will try to repeat your question.
Please speak up and ask questions and find out information.
I don't need a microphone.
Oh, you don't?
I've seen in the notes that there's going to be an enrollment period.
Yes.
How difficult is that going to be? Is there going to be a lot of support, like in the group homes? I mean, how is that going?
Yes, we're going to be given paperwork to, hopefully you'll opt in. You have an option to opt in or opt out. If you opt in, you'll continue to get the Service Coordination Plus. If you opt out, you'll get a watered-down version. So I would encourage you to opt in to the PCS CCL. And that paperwork, Sure.
How you doing? I'm Michael Segment again from Person-Centered Services. I came from Arc, Erie County in Buffalo, 28 years. 18 of those years in service coordination. So I know a lot of parents and families and advocates and what you're going through. And this change is very important. It's a big change, but it's different. I can speak to anyone that has a family member that has been with OPW more than 17 years. It changed in 2000 of March. It was CMCM prior to that. It moved to Medicaid Service Coordination in March of 2000. So it's a change, it's a bureaucratic change, but it's going to happen, and we're going to make it as smooth as possible. So you have an option to opt in or opt out. And what that means is basically opting in means you're getting what you're getting now. It's no different what you have as a Medicaid Service Coordination service. So some people have plan of care. That's where you monitor your ISP twice a year, up to 4 times a year. That's the lower level service. Those are typically individuals that have lots and lots of support. But we're encouraging people to move from plan of care to the regular care coordination care. Why? Because right now your life might be stable, but in the long run, you may need a little bit more. And you're not going to have to do anything different to get a little bit more. So most importantly, if you're getting regular Medicaid service coordination now, you're going to opt in. Opting in only means you're getting what you're getting now plus a little bit more. And when I speak of a little bit more, that's the care coordination health home side. So when you hear of health home, it's not bricks and mortar, it's a support service. It's care coordination and health home mean the same thing. So a CCO/health home, that's the same organization. That's PCS. That's who we are. Your service coordinator is no longer going to work for ARC Livingston-Wyoming. They are going to come on board July 1st and work for PCS. We're covering the 18 counties, the 35 member agencies. All their service coordinators are going to become care coordinators on July 1st for PCS. You get that option to say yes or no. There is another CCO that's going to be in the Western region. And in that introductory level, you're going to get a choice. You're going to either come on board with PCS, which most people will, because your home agency now is joining us as a member agency. Or you'll be able to choose Prime Care, who's out of Rochester. They're another CCO. There are 6 care coordination organizations in New York State. They all will have Miskell, which your agency is familiar with. PCS will also have Miskell. So that information is going to come out to choose your service to opt in. And opting out would primarily mean you're getting a basic service that's going to support your waiver. I'm not encouraging that because at any time things could change in your life. So the opt-in and a little bit more is the medical and the behavioral health model. So if you're happy with what you got right now, but something happens down the road, so for example, aging parents, you're concerned what's going to happen to my child, they don't have an IRA placement, maybe we're supporting them in the community through ComHab. Well, there's this RIOS, which is a Regional Health Information Network, and it's called Healthy Link, and Rochester also has a RIOS. So you can join that RIOS through your care coordinator, and it's by choice only. That's the little bit more that you're going to get. And what that RIOS does is link all your care providers together. So your doctor, your dentist, your therapist, and that RIOS also sends alerts, which is helpful for people who live in the community that don't have supports. They might not have an IRA support, they have aging parents that can't really assist, or now they've recently been orphaned. And that RIOS will send alerts to your care coordinator and to anybody you want. Aunt Lucy in Arizona. It will make people aware of what's going on with the person that in your family or your loved one. So that's the little bit more. That's why we're encouraging when that letter comes, when you get that option to say opt in, opt out. Opting in is everything you have now plus a little bit more. And you will have that choice because we are person-centered. Hopefully that helped.
That was a great point to bring up the sharing of the data and the information information. It's very helpful and share it with the family.
I have two questions that kind of follow on that. That's okay, I think everybody can hear me. The data, the shared data, that network, do families have access to that?
Yes.
Okay,
And
so
it's-
just like my chart with the,
Yeah, it's kind of just like your own health portal.
Yep.
A lot of doctors' offices
Yep.
are offering that now.
Okay.
And again, it's all consent.
right,
So it doesn't have, so you can still have a little bit more and not consent to the health Rios.
right,
You can change it at any point. You can decide, you know what, I want to join this health link, this Rios, this regional health information. It's part of the HIT. It was part of, it's in your packet, health information technology. So again, it's all based on,
that's great. The other question is, my family member lives in an OPWDD residence. So I'm wondering, is OPWDD moving their technology so they can talk to you so that I can coordinate or communicate, all the way around?
absolutely. OPWD is working very closely with person-centered services. And again, it's part of that Rios and that health information technology. If you live in an IRA, in an OPW IRA, and you consent to it, they can have that access as well. So everybody's informed. The whole interdisciplinary team, which you're a part of, is all involved for the same support for that person.
Excuse me?
Yes, I received a letter here. My son is in a state home, but I received a letter about the meeting from ARC. I was kind of surprised that it was ARC, but I'm here. Is this just ARC that's having these changes, or are the state homes having the same thing?
The state is having the exact same change, so your family member that lives in an OPWD state-operated facility is definitely having a change. They have a service coordinator, and that service coordinator, again, is going to also become a care coordinator. And that care coordinator is going to do the same thing that I just talked about. And in your pamphlet, if you go back through the PowerPoint, did you have those forms listed by OPW as well in there, or no? I know you flashed them up there. There's a couple more forms, I think.
No, we were told not to give out the fact sheet yet.
Okay.
That will be coming, and I mentioned it, that's why we need the emails. And I'm guessing you have an ARC service coordinator is why you were contacted for the meeting.
Go to the Person-Centered Services website. On the very first page, there's a green tab, and it says Learn More. And you click on that green tab on the Person-Centered Services website, it's going to have a listing of all the forums. And you can attend any of those forums that are listed on there. Some of them are requiring an RSVP and some are not.
Hi, thank you for all your help. The question that I have is with your RIOs, the healthcare RIOs. I'm actually a healthcare provider. I work for a provider. And my question is, does the RIOs communicate with the doctors and the specialty offices? Because they're, with HIPAA and things like that, I just wonder how that.
Yes, and they will communicate with that and through HIPAA. That's why it's going to have to all be consent-based. So if you're the guardian or your individual's their own guardian, they will have to have that consent. So anybody that has access to that RIOS, whether that's your healthcare provider, your care manager, or anybody on the IDT team, the interdisciplinary team, will be able to read that information and help support that person. But it's all consent-based. You have to consent to everything. It's all HIPAA protected, so we're going to respect that. As it's person-centered, we can't encourage that enough. That we want to respect your privacy, and we want to support your decisions, and we want to do that all through consent.
I have a nice packet of information there to go through. I'm available. Michael's available. So please read through that and keep in touch. Before we finish up here, I want to thank you for your time, and on behalf of the staff and the individuals who bring those words to life, people like, okay, we have Gemma, Andrew, Jason, Leah, James, Jenny, Justine, Mary Alice, Fred, Matt, who are your family, your friends, your neighbors, your co-workers, and your classmates. So thank you very much, and we hope to talk with you soon.
And I want to say thank you all for coming. I just wanted to mention Marcy Van Zandt, one of our board members, and this is her daughter Casey, who lives in one of our houses in Dansville. This is a picture of Heather Bump, who has worked at Finger Lakes Cookie here in Geneseo, and they are very much a supporter of our agency and do a fundraiser for us and donate money back to us, so please support Finger Lakes Cookies. And this is our DSPs, our annual picnic, and that isn't even all of them because somebody had to be home working some of the houses. Our programs, last year's trip to Washington, as an advocate for services, please talk to your legislators, both local and national. We need the funding, especially the Be Fair program. We need the funding in the governor's budget to support a living wage for our folks.